So starting with the first one, that is the types, the classification that we have in these arthropods. So remember the classes here are Insecta, Arachnida and Crustacea, right? So remember that it is IAC, that means internal auditory canal. So you can remember IAC, Insecta, Arachnida, Crustacea. Why I'm telling you to remember in the same sequences, because look at the number of legs that they have. It is 3 pairs, 4 pairs and 5 pairs of legs. So remember IAC is 3 pairs, 4 pairs and 5 pairs of legs. So depending on the pairs of legs that you see in the image, you can rule out the options. You know, whether if it's 3 pairs, it's something from Insecta. If it's 4, it is from Arachnida. Right? And remember that Insecta, they have the wings. Some are wingless, like for example, the rat flea is wingless, right? The Arachnida and the Crustacea, they do not have the wings. So if you see the wings, that means it is the Insecta. Now what comes under Insecta is what does not come under Arachnida and Crustacea. So first let's remember the Arachnida and Crustacea. For Arachnida, remember it is ATM. That means in Arachnida we have the ticks and we have the mites. Okay, so the ticks and the mites in Arachnida. Hard tick, soft tick and the mites. So you have the shiggers, the larva of mite is shiggers, right? The trombiculid mite, the itch mite and all of that. And in Crustacea, easy, C for sea cyclops. These are in the water. Okay, cyclops in the water, guinea worm in the water, right? Cyclops is for guinea worm. And the rest, everything else is basically your Insecta. So mosquitoes, what all comes here is the mosquitoes, flies, housefly, sandfly, blackfly, tsetse fly, all of that. The louse, right? And the fleas do not have the wings, the rat flea and the redwood bugs. So basically remember in Arachnida it is ATM, in Crustacea it is C for C, it is cyclops, rest everything is Insecta. Okay, the 3 pairs. Now going to the diseases that are transmitted by these vectors. So housefly, okay, house matlab domestic, Musca domestica is the name here for the housefly. So remember that housefly is basically your the diarrhea diseases, poliomyelitis, trachoma, all of that. And housefly does not bite. Okay, it is no bite here, it is mechanical transmission that we see here. Sandfly is phlebotomous, and sandfly, when you look at the image as well, sandfly is identified by that hairy appearance. Remember hair, kala hair, black hair, it is Kala-azar. The visceral leishmaniasis is by phlebotomous. Argentipus causes the visceral. So remember that Argentipus is like organs, Argentipus is organs affecting the viscera. Okay, then you have phlebotomous can also cause oriental sore, that is cutaneous leishmaniasis, or there is Oria fever as well. We have seen that in this rickettsial diseases, Oria fever. Oh yeah, carry on. Oh yeah, carry on, RR, that is BB, that is Bartonella bacilliformis is what causes this Oria fever. Okay, so Oria fever, oriental sore, all of that is sandfly. Tsetse fly, Glossina palpalis. Remember tsetse, sleeping. Okay, sleeping sickness. When we sleep, the palpebrae, the lids close. Remember, palpalis is the tsetse sleeping wala. Okay, and it causes the sleeping sickness of Africa, the African trypanosomiasis. Then what is American trypanosomiasis? American guys are like chava. You know, if you have heard this word, especially used in Mumbai. So remember, chava is a stud guy, right? So remember that Americans are chava, Chagas disease, American trypanosomiasis, that is American sleeping sickness. Redwood bug, also called as triatomine bug. You can remember this with the story of this Chagas disease is basically caused by Trypanosoma cruzi. So remember, Tom Cruise, American guy, is a chava. On a cruise, he tries to kiss the girl with the red lips. So what does this stand for basically is Tom Cruise, Trypanosoma cruzi, chava is chaga, American sleeping sickness, tries is triatomine bug, it is also called as kissing bug, or the redwood bug. Okay, these are the various names. And remember that Chava also means a Romeo, romantic person. So there is Romana sign which is seen in Chagas disease. Okay, Romana sign is seen in Chagas disease. Right, these are all the important points. Coming to black fly. Okay, black fly simulum. Okay, the black fly simulum is onchocerciasis or river blindness. So remember that river blindness is black. When someone is blind, everything looks black. So remember, river blindness is the black fly. Black fly is like the black zindagi. Puri kali zindagi seems like now there's nothing in life. When does that happen? When someone gets cancer, that is onco. Onco matlab cancer. So onchocerciasis. So river blindness, onchocerciasis, black fly is what you should remember. Soft tick is QRS, that is Q fever. Relapsing fever is soft tick. Okay, KFD you can miss. So Q fever, relapsing fever is soft tick. Next one is hard tick. Okay, so here we have a very interesting rap that I've made for you to remember the diseases transmitted by the hard tick. So the rap that you have to remember here is, remember, baby tu hai hard, tick, tick, tick. Okay, baby tu hai hard, tick, 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 hard like a rock, tick, tick, tick. And then the baby says, ये क्या फालतू लगाया है? क्या फालतू is KFD. Okay, so ये क्या फालतू rap लगाया है? So remember that it is baby tu hai hard, tick, 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 hard like a rock, tick, tick, tick. And the baby says, ये क्या फालतू rap लगाया है? Okay, so remember that baby is babesiosis. 2 is tularemia. Hard tick. Okay, tick wali sab, tick paralysis, tick encephalitis, tick hemorrhagic fever, Indian tick typhus, sab tick, tick, tick. Rock is the Rocky Mountain spotted fever. Then the baby says, kya faltu? That is KFD. Okay, that is KFD. So remember, hard tick is baby tu hai hard, tick, 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 hard like a rock, tick, tick, tick. And the baby says, kya faltu rap lagaya hai? Okay. Now the next one is louse. Louse we have seen is very provocative, spreads like an epidemic. Then comes the trench. When you put the Medicare, it goes down. But again, when the kid goes to school, ये वापस आ जाता है like relapsing. So it is epidemic, it is trench, and it is relapsing. Epidemic typhus, trench fever, and relapsing fever. Mite, trombiculid mite, gamacid mite. So scrub typhus is trombiculid mite, rickettsial pox, सब कुछ गंवा दिया. We have seen this in rickettsia. So scrub typhus is Susu-gamushi and it is trombiculid mite. Shigerosis SC. Remember, for scrub typhus we have seen Susu-gamushi, shigerosis, trombiculid mite. Flea is rat flea, that is the plague. Which plague it is? Remember that this is the bubonic plague, not the pneumonic plague. Pneumonic plague, like the term says, pneumonia, lungs wala, it is aerosol inhalation. Murine again is mouse wala, that is rat wala, murine typhus, ulta pado endemic typhus, caused by rickettsia typhi. We have seen the mnemonic for that, that is flint. So flea, endemic typhus, rickettsia typhi. Anopheles is malaria. Malaria is the female Anopheles mosquito. Culex. Okay, Culex are cute Japanese. Okay, Japanese are cute. Japanese encephalitis. And remember that LE. Okay, LE is the West Nile fever. Okay, Bancroftian, C wala. Okay, Bancroftian filariasis, not the Brugian filariasis. So Bancroftian, C for C is Culex, and the viral arthritis. So Culex is cute Japanese encephalitis. Culex is the West Nile, and the C is the Bancroftian filariasis. Aedes mosquito, you write it as Aedes. Okay, you spell it like AYDECZ, Aedes. So Aedes causes yellow fever, dengue, chikungunya, and Zika. Okay, so it is yellow fever, dengue, chikungunya, and Zika. Okay, that is Aedes. Mansonoids, MAMA is Malayan, that is Brugian Filariasis. Mala drinks brew coffee. So Malayan, Brugian Filariasis, and chikungunya. Remember, Brugian Filariasis for Mansonoids. MAMA Mansonoids, Malayan or Brugian. Okay. Now what we'll do is we'll read about mosquitoes in a bit detail because that's important for your exam. So the life cycle of mosquito, what are the stages? Remember, it is ELPA: egg, larva, pupa, adult. The coiled one is the pupa stage, then you have the adult, and this is the larva in the water. Now look at the characteristics of the mosquitoes. We have Anopheles and we have the Culecinae family, which has the rest of the three. The Culex, Aedes, Mansonia. Anopheles is Anopheles. Now, which eggs are laid singly? Now, the mosquitoes which lay the eggs singly is Anopheles and Aedes. Okay, the Aedes. So, remember A is the first alphabet. So, it is a single egg. Okay, one egg. So, Anopheles, Aedes, eggs are laid singly. So, how do you differentiate the two? Anopheles, they have the lateral floats. Anopheles have floats, the rest are not provided with the floats. So remember, Anopheles, FEL is the floats present. Coming to the larva stage, Anopheles ka larva is parallel to the water surface. Inka jo hai, inka head is niche. Here there is no siphon tube in the larval stage. Okay, so remember that Anopheles, when it is like a kid, small larva, it is straight, seedha sada. But when it becomes an adult, it becomes theta. It rests at an angle of 45 degrees. So जब बच्चा है तो बड़ा सीधा है, but जब बड़ा हुआ तो it becomes theta, right? It gets a lot of spots on its character, does so many bad things that it becomes theta. It does a lot of bad things and it gets the spots on the character. So basically the wings are spotted in Anopheles. Here the wings are unspotted and there's a hunchback. Okay, no siphon tube in Anopheles. So remember that Anopheles, NOPH is no siphon. Okay, there is no siphon tube in Anopheles in the larval stage, right? And the pupa has the siphon tube that's present here. So these are the important points that you should remember here. So remember that AA is single egg. Lateral floats in Anopheles, no siphon tube in Anopheles. बच्चा है तो सीधा है, बड़ा है तो inclined at an angle, and the wings are spotted in Anopheles. So look at this one. The images here, the egg with the lateral floats, that is Anopheles. The larva is parallel, सीधा साधा, straight is parallel. Sitting at an angle when it's an adult is Anopheles. Okay, the rest are not sitting at angle. Okay, यहाँ पे इनका उल्टा है. Single legs is Aedes and Anopheles. Okay. Now coming to the diseases caused by mosquitoes, this we have already seen, right? That's the same table. Anopheles is malaria, the female Anopheles mosquito. Culex is Q to Japanese, West Nile and Bancroftian. Japanese, West Nile, Bancroftian. Aedes is AYDECZ. Yellow fever, dengue, chikungunya, and you have the Zika virus. Mala or Brugian Filariasis. Coming to the rest of the important points about the mosquitoes, the diseases we have seen. Breeding habitat. Anopheles is sophisticated mosquito. Anopheles, PHPS is sophisticated, so it will stay only in clean water. Culex do a lot of kal, that's the nuisance. Itna kal karte, itna nuisance karte. They are nuisance mosquitoes. They grow in nuisance, that is dirty water. Okay, Culex is the dirty water. Aedes is artificial. Mansonia like monsoon, water bodies containing aquatic plants. This is where you will see the Mansonia. Okay, eggs are laid singly in Aedes and Anopheles. There is lateral floats in Anopheles. Okay, in Culex it is clusters, in Mansonia also it is clusters. Larva, no siphon in Anopheles, rest parallel. Here the rest have the siphon tube and they are not parallel. Rest one, the pupa we have seen, the adults we have seen, very important, inclined at an angle. There are spotted wings. There is hunchback here, wings are unspotted. And Aedes mosquito is the tiger mosquito. It has the stripes. Aedes is tiger. Okay, Aedes is tiger. It has the minimum flight range is for Aedes mosquito. Remember, Aedes is very airy. Airy in Hindi means, who does not want to do a lot of work, very lazy. So it does not fly very far. So Aedes is airy. It is the tiger mosquito. Culex calcal nuisance. Sophisticated is clean water Anopheles. Okay, these are the important points. Let's identify the image here. This mosquito you can see is sitting at an angle here, right? So this is Anopheles mosquito. The wings are spotted. Anopheles mosquito, wings spotted. So in an adult becomes theta, sits at an angle, the wings are spotted. This is the stripes that you are seeing here. So this is like a tiger mosquito. This is the Aedes mosquito. These images are very, very important. Okay, very, very important. What is this one? This is the makhi that we have in our house. Housefly, house domestica, musca domestica. Right, what does it transmit? The diarrhea, dysentery, poliomyelitis, trachoma, all of that. But remember, it does not bite. Okay, no bite. It is mechanical transmission. This is the makhi, housefly. What is this one which has a lot of hair? Okay, hairy appearance. Hair is Kala-azar wala, that is the sandfly. Okay, that is the sandfly. Kala-azar. Visceral is Argentipus. Argentipus organs is phlebotomous. Visceral leishmaniasis. Other things are oriental. Sore. Remember, sandfly is the vector for oriental sore and also the Oria fever or the carrion's disease caused by Bartonella bacilliformis. What is this one? Which looks very, very smart bug. दिखने में ऐसे कुछ अलग दिख रहा है, foreigner जैसा. So, African या American trypanosomiasis. So, this is the Tsetse fly. Okay, ये अपना routine black वाला नहीं है. Not the housefly वगैरह. This is looking like a different one. Tsetse fly, African American wala. American is basically a redovid bug. The Tsetse fly here, Glossina palpalis. So remember, that is the sleeping sickness of Africa, African sleeping sickness, Tsetse fly. Next one, this is black in color. This is Blackfly. Okay, Blackfly. Onchocerciasis, जब cancer होगा, the life becomes black. Onchocerciasis, blindness, black is blindness, river blindness. This is also called as simulum. Okay, also called as simulum. Next one here, this is a louse, right? As a segmentation जैसा or a 3 pairs, this is a louse. Epidemic trench relapsing. Okay, epidemic trench relapsing. So this is louse again. What is this? Brown color, rat mouse के जैसे brown color. This is the rat flea which does not have wings. Okay, this is the rat flea. Rat flea causes bubonic plague and it causes flint, that is endemic typhus. Okay, endemic typhus. Next one, what is this? The one which has this pointed mouth like a pout. Okay, pout for kissing. So remember, this is the kissing bug, kissing with the red lips. This is the redovid bug, triatomine bug. Who is trying to kiss the red lips? Tom Cruise, Trypanosoma cruzi. That is, he is a Chava. That is Chagas disease. Okay, Chagas disease. Coming to ticks. Ticks belong to which class? Arachnida. Remember, Arachnida, ATM, ticks and mites. We have the hard tick called as exodid tick and the soft tick, Argacidae. Look at the hard tick. The hard tick has a pointed end like this. Hard, okay, pointed end. Soft tick is round and round like this. Okay, soft tick is round and round like this. Hard tick has this pointed end. Okay, so look at the difference between the two. Hard tick, exodid, soft tick, Argacidae. The scutum covers the back in males. In the hard tick, there is no scutum in the soft tick. The head is located anterior. The head is not seen from above in soft tick. Okay. Next one. Remember that the disease is transmitted by hard tick. Baby to a hard. Right. Baby to a hard. Tick, tick, tick. Tick typhus, tick fevers. Hard like a rock. Rocky Mountain spotted fever. So it is kya faltu lagaya re? That is KFT. Okay. And remember that in babesiosis, you have the Maltese cross appearance. Maltese cross appearance like this. Okay, you will see in babesiosis. So in hard tick you have dermacentor and hemophysalis, and soft tick is QRS, Q fever and relapsing fever. Okay, Q fever and relapsing fever. What are we seeing here? This is a mite. Okay, this is a mite. ये red color का जो दिख रहा है basically. This is a mite here that we are seeing here. The hard tick was not red in color, right? So remember, for mite, it is the scrub typhus, trombiculate mite, gamacid mite is rickettsial pox. This one, which looks like it is doing a swimming essa, swimming water में crustacea. This is cyclops. Okay, this is in water. So remember, ऐसे swimming करने वाला, basically this is cyclops, and cyclops is important for guinea worm disease and also for Diphyllobothrum latum. Okay, for Diphyllobothrum latum. Remember, Diphyllobothrum latum, di matlab two intermediate host. It has the fish and the cyclops. So if you see fish and cyclops in the life cycle, it is Diphyllobothrum latum. Now a quick review here. Tell me, what vector do you think is this? What arthropod is this? Black brown color with the pointed end, that is the hard tick. Okay, this one here is the hard tick. Baby to a hard wala. Okay. Now coming to the types of transmissions. What is propagative, what is cyclopropagative, and what is cyclodevelopmental? So by propagative transmission, we mean that in the vector, the disease agent, the causative agent is only multiplying. Propagative matlab multiplying. Cyclopropagative matlab multiplying but also undergoing a cyclical change. There is development plus the propagation. Cyclodevelopmental means only the cyclical development. There is no propagation here. So here there is no development, here there is no propagation, here there is propagation plus the development happening both. So how do you remember which is propagative? Propagative is like multiplying, right? So multiply, remember, is plague and yellow fever. Okay, multiply. Okay, multiply is plague and yellow fever. So plague bacilli in rat flea and yellow fever is by Aedes. This is your propagative. Cyclopropagative matlab both. So remember, malaria is all. Okay, all happening is AL, all is your malarial parasite in Anopheles. It undergoes the development and also multiplication. Developmental. So remember that for developmental, just a minute. Developmental, DEFG. For developmental, the F and the G, that is filaria and guinea worm. So filarial parasite in the Culex, Bancroftian Filariasis, guinea worm in the cyclops. This is just the developmental that's happening. So developmental is DEFG. Malaria is all. That means cyclical development plus propagation. Now let's try to solve some MCQs on this topic. So the first one here, water from a broken septic tank is collected and you are seeing the mosquitoes here. Identify the species. The question itself is clear that the septic tank is the dirty water. Dirty water is the nuisance Culex mosquito. Okay, that is Culex. Next one here, what is the vector here I see? It is the Sandfly because of the hairy appearance. And the condition is identify the vector. So I answered this question, this is Sandfly even without reading. But now if you read here, Bihar ka patient with fever, weight loss, hepatosplenomegaly, you think of the Kala-azar, the Leishmaniasis. Bihar, UP history is common there. Next one, again Uttar Pradesh, hepatosplenomegaly, there is pancytopenia. There are macrophages laden with organisms with a kinetoplast, that is Leishmaniasis, that has this kinetoplast, right? So this is Kala-azar again, UP ka history, Leishmania, Kala-azar is Sandfly. Okay, that is Sandfly. Outbreak of buboes, what is the vector? Bubonic plague. Plague is the rat flea and rat flea is the Xenopsilla. Okay, rat flea is the Xenopsilla. Next one here, what do I see here is, which of the following diseases is it a biological vector for? And what do I see here is, what does this look like? Okay, This looks like the redovid bug. Okay, this looks like the redovid bug, that is the Chagas disease. Sleeping sickness is Tsetse fly. This is not the Tsetse fly, we had seen that. Leishmania is Kala-azar Sandfly, hairy appearance भी नहीं है. Babesiosis, hard tick भी नहीं है. Right? So pointed end भी नहीं है. So even by ruling out the options, we come to the Chagas disease. Which of the following depicts the life cycle of Diphyllobothrum? 1, 2, 3, 4. So Diphyllobothrum, we said, has two intermediate hosts, the fish and the cyclops. So all I need to do for parasite life cycles is look at the host here. In the first image, I see the cyclops and I see the fish. So I think it is this one. Okay, so the correct answer here is 1. The rest of them, you are seeing something like this, the cattle वगैरह here. You know, यहाँ पे ये larva दिख रहा है, skin से जा रहा है. This is snail वगैरह. This is what we see here. Diphyllobothrum is by eating of the fish. The L3 stage, plerocercoid stage of the larva is the infective stage. And remember, it causes vitamin B12 deficiency. Vitamin B12 deficiency is Diphyllobothrum. Another question, if I tell you that a patient went for a hiking and after that, abhi usko rash hai, which has this bull's eye appearance. Right? So, in which condition do you see the bull's eye rash? Bull's eye is seen in Lyme disease. Okay, it is seen in Lyme disease, Borrelia burgdorferi, and remember, it is because of the tick, the hard tick, the Ixodes tick here basically. So remember, it is the tick, the Lyme disease, Borrelia burgdorferi. Okay, Borrelia burgdorferi. So this is the summary table of the vectors here. Take this as your one-page note because this is very, very important for your last-minute revision. One day before the exam, all the vectors and their diseases, we have discussed the entire table. Right, this is just the summary. So make sure you have this in your book or on the wall. Right. So thank you so much. This was about the vectors, the arthropod-borne diseases. Do your homework of practicing the MCQs and making the notes. Notes making will take some time, but trust me, it helps you build a lot of visual memory for yourself, and in the long run, it helps. Right? So don't be lazy in making your notes. Thank you so much.